dashur teleshikues të televizionit të shqiptarëve të Amerikës, jemi këtu në një nga klinikat dentare të cilën ju mund ta keni mirë njohur në televizionin ton. Jemi pikërisht me doktoreshën Shiva Hogugi, e cila ka kryer shërbime dhe vazhdon të kryejë shërbime edhe për anëtarët e komunitetit ton këtu në klinikën e saj, për t'u interesuar më mirë mbi procedurat, mbi atë çka ajo realizon dhe çfarë ju ofron konsumatorëve shqiptar, ne intervistuam atë në zyrën e saj. What kind of procedures your clinic can provide to the Albanian community?
I just wanted to say hi to all of my Albanian friends, and here at the dental office, first and most, I like my patients to be treated the way I like to be treated. So the minute they walk into the office, they are being greeted by my friendly staff, and I don't make patient wait, so I'm usually running on time because their time is as important as mine. Here I do all aspects of dentistry, from cosmetic dentistry to all the root canals, partials, dentures, extractions, and some implants, placement of the implants and restoring them. So covering almost from A to Z. All the gum disease are being treated right here by my staff. Sometimes if it's needed, I send patients out to specialists. So whatever I decide that the patients would be treated the best.
What are some of the main procedures that are done often from patients' request? For example, you said that you do yourself a root canal here. So in some of the offices, they send to other.
I have always done all my root canals here. Very high success rate from all the front teeth to the back teeth. A lot of offices I've noticed they send the molar root canals because it's very technique sensitive. We have to work in a very sterile situation so the root canal doesn't fail. Because you do a root canal and then after a few years it can fail because it was not done sterilely. All the back teeth molars I do here again. Hardly we send patients out. If you have a gum disease, we first treat you here, and I have very close relationship with the periodontist around me. And if you're not getting results, if the pockets are not getting back to normal, if we see still disease is there and they need surgery, then we send the patient to the periodontist to do the surgery.
You mentioned the implants. Do you do the implants here or do you create the base for the implant?
I do some of my implants here. So mostly the back areas, the back teeth, the implants, I place them here also, the surgery part. And I do it in one step, so the patient usually doesn't have to come back for me to open it, because usually you do the surgery, then you have to go back for the surgeon to open the area, and then to get the okay, then they send you to me. When I place it here, I do in one step. So after 3 months, you come back, I just look at it, everything is okay, it's hardened, your body took it, and then I just take the impression. So there's no need for the second surgery. And I send it to the lab, and the crown is back.
One of the problems that the patients have is the relation with insurance. Or we have other patients that don't have dental insurance. How do you deal with this?
With insurances, with people who have insurance, we most of the time the more expensive procedures, I like to send it to the insurance to get pre-authorization. So if it's for deep cleaning, it's for crown, some procedures or implants, I first submit it to the insurance just to make sure the patient is covered and they have it in their hand exactly how much they have to pay. So there's no surprises. I don't want any of my patients to receive a surprise bill. So for the most expensive procedures, I do that. For patients who don't have insurance, I created an in-house insurance plan. With that, they pay fee upfront. It's a yearly fee. It's either for one person or for the whole family. And they can call the office and get the details of it. But with that fee, 2 cleaning in 2 exams and all the necessary x-rays are covered with that. So they don't have to pay anything out of pocket. And on top of that, I will give 25% off of my fees for those patients. And I checked most of the insurances, and this would be the fee that if they even had insurance, they had to pay. I participate with all insurances. That means whatever insurance that specific insurance is paying for, whatever procedure, I accept that. So I don't charge the patient the difference. So I looked at all those insurances, and the fee after 25% is very comparable to those. So the patient really don't have to even buy insurances. I've had a lot of my patients who had insurance and they canceled it. They're getting this nominal fee for the office, and then they're covered.
You are a family dentistry. Do you have special dentists for kids, or do you treat kids here?
I treat them myself. Again, along the same line that I was saying from the beginning, we make patient very comfortable. From the time they come back, we talk to the patient. I see a lot of kids, a lot of very difficult kids, and they are scared from whatever they have heard, and they're usually bad jokes about dentists, so they make them more scared. I provide complimentary laughing gas. So I've heard a lot of offices they charge, but here it would be free of charge. You want to get the cleaning, you want a nitrous, you want a gas, we give you gas. So from the minute you walk into the office, we make sure you're comfortable with the gas, or I have patients who are very nervous. I prescribe them relaxing medication, so they take it from the night before. Or even one more step, some procedures like almost all my implants or anything else, if they're very scared, on top of the relaxing medication the night before, I have another medication that I provide in the office, but they have to have it right. So it's comparable to the IV sedation, but it makes them very relaxed and sleepy, but they're still responsive to me, and but they won't feel or have the impact of what happened in the office.
What about cosmetic dentistry? So what procedures do you provide here?
Cosmetic dentistry, we do different kind of whitenings. We have trays that we can make, so you can take it home, and we provide you the gel. You do it at home. We have two different kind of in-office whitening. One is Zoom, and that would take many shades up, higher, wider. And there's another case that I have here. Then patients love it because the fee is nominal. It's much less expensive than Zoom, but still it's in office and it does a very nice job. It doesn't involve any impression taking, and I send you home with a special pen that you can continue for 2-3 times more at home. And I do all sort of veneers, and I even for the back teeth, I don't do metal on my crowns. They're all metal free, and they look very natural.
Dr. Shiva, do they tell the patients the procedure and the cost of every procedure?
First visit as a new patient, when you come in, I will give you a complete treatment plan. I give you exactly in how many visits and how much it would be to complete the job. And of course, it would be only anything that you would need. Otherwise, if anything, any procedure can wait, I keep an eye on it, and we monitor that, and we can go back to that, talk again in future. But anything that absolutely need to be done, I give you a very clear picture. And as far as the finances, again, at every visit, every single visit after that, when you come in, we tell you how much this visit is and what exactly we are doing. And before I do anything, I will explain it completely, and you can ask as many questions as you want. All me and my staff, they're very patient. A lot of patients have a lot of questions. A lot of them are very anxious, have anxiety. So we take our time until they are very comfortable as far as what procedure is being done and how much it would be. And with most procedures, I give a post-op call at night to my patients, just to see how they're doing after the procedure is done. And I'm always available because my cell phone is on the message in the office. Yeah, so anytime they want, weekend or non, they can call me. For our patients' convenience, we have 2 late nights. We are open until 7 o'clock, and one last Saturday of the month we are open.
Dr. Shiva, you are well known with the Albanian community for the service you provide to them, but what do you have to offer to them? Why they have to come here at your facility?
I want them to feel comfortable. So I want to have a very trustworthy relationship. It's all about trust. I make them feel very comfortable at the office. There's no surprises. And I want them to feel at home when they're here. I want them to feel that anytime they can call me or they just can come for any consult. By the way, the consults are free. So if they need just to get some opinion, what I think is free even if I have to take any x-rays. So I give them my honest opinion. So I think that the trust that they can have in their doctor is invaluable. We have a program here that if you refer a patient, you get $25 off, comes off your treatment. For my Albanian friends, on top of any ad that I would put anywhere, if they mention this TV ad, I can take $25 off extra.
Thank you very much. Faleminderit edhe në emër të komunitetit shqiptar, doktoresa Shiva, e cila gjen gjithmonë kohën edhe për shqiptarët të cilët jetojnë në këtë zonë për t'i ndihmuar ata me nevojat që kanë për problemet me dhëmbët. Është një partneritet mjaft i mirë midis doktoreshës së televizionit tonë që i shërben më së miri komunitetit shqiptar. Miru takoshim në bizneset tjera.